The long-term effects of the COVID-19 pandemic on families who lost loved ones is devastating. UNICEF sharing new data from the Imperial College of London showing around 150,000 children left orphaned as a result. The number rises to over 207,000 when you add children who've lost their primary or secondary caregiver. Toby is UNICEF South Africa's Chief of Communication and joins us now. Toby, good evening to you and welcome. Tragic realities really when we read those statistics. Tell us more about the scope of the work.
Yeah, no, thank you. It is a tragic reality and it really brings home, I think, that impact of COVID, on children specifically, but also on households more broadly and on society as a whole. It's a massive number of children who have been affected by losing a loved one, essentially. And what that means is, of course, it means that deep stress, deep trauma that any child goes through if they lose a parent or a caregiver, primary or secondary caregiver. It's extremely stressful and it brings up a lot of issues that can last over many years, which is why it's so important to provide the support, the protection, and most importantly, the stability that these children need. But it's also important to remember that a lot of these children will be with loving family members, loving extended family members who can care for them, who can nurture for them, and will do whatever they can to give them that stability. But it's trying to sort of add that extra layer of protection where we can, as UNICEF, working with government, working with partners on the ground.
And I want to go into that, particularly when you speak about these psychological impacts. Often, we occupy ourselves with the structural stuff. Are they going to school? Are they getting well fed? Do they have the welfare infrastructural support around them? But the emotional damage around this, event happening and robbing them of their parents is something that often is the last thing on the line. Did the report? What did the report find out about the living conditions specifically and the welfare of these children?
Yeah, no, that's right. I mean, the mental health impact of going through such a traumatic experience is massive on children. And UNICEF, we work in South Africa, we work across the world on those issues. And I think on a positive side, the mental health stigma, that has existed for many years in many countries is being broken down. Children, young people are talking more about mental health issues. UNICEF, we're working with Childline, with the Department of Social Development and others to try and get children and young people to access the support services, when they need it, if and when they need it. But also at the same time, you mentioned schooling and education. That's so important because that stability can really provide the extra support that children need to recover and to move on in their lives. And I think the hope really comes from the fact that children are resilient, with the right support, with the stability of a childhood like any other child, going to school, playing with friends, being supported, cared for and loved for, can really help children to recover. There's always some who will need that additional counselling or additional psychosocial support. And that's where we want to make sure we do whatever we can, to make sure no child falls through the cracks.
UNICEF South Africa is working with the South African government to provide some of these, these cushioning environments or these environments where kids can transition back into, things like good mental health care. How is that happening, Toby?
Yeah, that's right. So for example, we work on the Safe Parks initiative. Safe Parks are in communities. It's a space where children and young people can go, after school, even before school in some cases, where they can get additional protection and support. So for example, it can be, homework support even. They can talk to a counsellor. They can get healthcare. They can get referred to other health services if necessary. And just as an example, I met a child and youth care worker at a Safe Park in Soweto not so long ago, and she herself was an orphan. And she said that she was, unfortunately, in her case, she was pushed out of the home by the uncle who was taking care of her. But the safe part that she could access at that point really basically saved her life, is the way she put it. And now she's working there as a child and youth care worker, providing back to vulnerable children. So that additional protection within the community can really play a massive role if that care is not there at the family level.
Well, when I was reading this report, the thing that came to my mind was, South Africa and dealing with the phenomenon of child-headed households, some of that being, the legacy of HIV and how it ravaged society. Are there any parallels and lessons to be learned from that phenomenon? I don't want to parochialize it by calling it a phenomenon, but what I mean is when that happened and families were lost of caregivers or adults, and children were left with the burden of raising themselves or each other. Are there some wisdoms that came out of that era that can be used in this environment with COVID?
Yeah, absolutely. And I think that the first thing is we need to prevent more deaths. Yeah, and that's the same with HIV/AIDS pandemic. The first thing was to prevent deaths, get treatment to people as quickly as possible. So let's not forget that COVID is still around. We need to prevent more deaths of caregivers, more deaths of parents, and get as many people vaccinated as possible if they're not already. And then we need to provide that family-based care, that family support service where we can, household visits, safe parks that I mentioned, training for educators as well in terms of how to work with children who have been through traumatic experiences. Let's not forget for caregivers who take on an extra child potentially, or even in the school environment for teachers, it can be very difficult, working with children who are recovering from a traumatic experience. So it's providing that extra support layer there as well, and really stepping in where we can. And I think over the years, child protection systems have certainly been strengthened. And what's key now is to make sure that people know where to access those support services and scaling that up as well. And that's where also the private sector come in, other support comes in to help to scale up and provide as much access as we can to vulnerable children.
Again, an important question I omitted to ask at the very beginning is what's the profile of these children? Are they under or over particularly a certain age group? And, is there an opportunity for South African society, those who want to help for those children who don't have a support system, to try and adopt maybe?
Yeah, so what we see is I think the majority are between 11 and 18 years old. Is a big proportion of children who have lost caregivers. And those are children who are going through a transitional part of their life as well. So transitioning from childhood into adolescence, into adulthood. And so it's also very important, let's not forget, sort of further down the line when children are moving into 16, 17, 18-year-old age group, that we can step in there and try and provide those opportunities, the skills building, building CVs, getting opportunity for work mentorships, and any really filling in there where young people might miss out, particularly vulnerable children. And of course, that's a challenge for many young people in South Africa as a whole. But we can do a lot in that space, working with multiple partners as well. So there are all these other elements that come in for adolescents and youth, making sure they get the support as well. Because actually what research shows, not just in South Africa, but globally, is that these adverse childhood experiences can then actually impact on work, life further down the line. Yeah. And so it's really, really vital that we provide the support they need now.
Well, thank you for sharing the outcomes of that report. So important and something to really think about quite seriously. Toby Fricker is UNICEF South Africa's Chief of Communication.